Thank you and congratulations on coming this far. Today we are going to do vasodilation and hyperventilation. Fancy words, but actually it's very simple. This happens naturally in your body, and we are going to harness that to give maximum benefits. What is vasodilation? You see, you look at your hands, look at your veins, look at your arteries, which are bigger. You will find the veins are slightly bigger than the artery. The reason is because there is some little bit of CO2 present in the veins, because it's the blood which is going back to the heart to get purified. So because there's some CO2 in the blood, which causes the blood vessels to expand a little bit. So that's why you see it is slightly increased in size. If you look here. And also, it's also present in plants. Now, we had a greenhouse. In the greenhouse, we grew cucumbers. If we introduced CO2 at 1000 parts per ppm, 1000 ppm, which is hardly anything, really, if you ask me, 1000 parts per million. This was introduced in such a way just before sunrise, and would you believe, because of the CO2, our production was 40% more. How did it happen? The CO2 caused all the capillaries in the plant's structure, from the stem to the plant, leaves and everything, they open up a little more. When they open up a little more, they have more transpiration, more flow through of nutrients, causing it to perform better than a normal plant. So that's what we're trying to achieve in our own body. We have vasodilation happening. We don't know when it's happening, but it's happening, natural process. You have a little problem with your heart, the doctor gives you a pill and all your blood vessels dilate. It's done under duress. That's not what we want. What we're trying to do is create vasodilation at the right time to increase the transport area so that we can send blood efficiently to far away into our body. And it's only useful, let me tell you, if your vasodilation is done and you don't do hyperventilation, in our case, it's a waste of time. So you have to do it in conjunction with hyperventilation. So coming back to see how to create this vasodilation, how to create the blood vessels going bigger. There is something known as hypercapnia, or the increase of CO2 level in your arterial blood flow. We talk about the arterial blood flow. You see, we have the respiratory system and we have the circulatory system. They somewhere meet at the interface within the lungs and the heart. One of the respiratory system, it creates oxygen or CO2 into your lungs, and the blood, when it comes there, it takes away all the fresh blood. But if there's some blood having a little CO2, that goes also into the respiratory system, and that's how the hypercapnia is caused. But this only happens if you breathe slowly. If it's done slowly. If you're breathing too fast, if you're hyperventilating, you will never get that effect. So the trick is to do everything slowly. With hypercapnia, you have increased CO2 in the arterial blood flow, which causes the outcome called vasodilation, which we are after. The basic idea is, the basic, if you inhale 1 and exhale 2, you can inhale 1 and exhale 3 also. Inhale 1, exhale 4. What that means is 1 unit at a time, and this is exhale 2 units of time. I personally have reached a level where I can inhale 1 and exhale 3. So basically in 4 units of time, I do 2 breaths. Right? In a minute, I can do 2 breaths. So you can inhale and exhale. See, like I was having an idea in the car today, and I got an idea. When we have peanuts, now when we eat one peanut, we get the taste, we get the crunchiness, we get the oiliness, or whatever the peanut's supposed to taste. Now you put 10 peanuts in your mouth, and you breathe and you eat. You have the same feeling as you eat one peanut. With respect of time, you're quite happy with one peanut. It's nothing but sustenance. Here, when you take a slow breath, it will sustain you. But we think it won't. So what happens when you're inhaling, instead of 5 seconds, you do all the inhalation in 2 seconds because you are greedy for the air, right? But if you slow down and say there's no hurry, and you slowly breathe in, and the same thing with the exhalation. Sometimes when you exhale, you're ready for the next breath. So you exhale too fast, right? And you can't do that, double the inhalation. So if you exhaling slowly, only then will you control your mind. Yeah, because your mind is what you're trying to calm down. When the mind calms down, your body muscle tone calms down, your blood pressure comes down, everything happens. So the idea is all with the breath, you can do all that, but you have to do it slowly. Inhale slowly and exhale slowly. For this time, you are not, when you're doing this breathing exercise and meditation, remember, for 15-20 minutes you switch off, you're doing nothing else but this. You are dedicating this time to your own body, to yourself. So it's very important. No outsiders are welcome. You've got to find time for that. There are exercises, of course, to create this vasodilation. One is Alom Vilom, which is called alternate nostril breathing. This is a very effective way of doing it because it also at the same time balances your system, your left and right system, your brain. Left and right brain is balanced. You have less blood pressure. It's very good for your Alzheimer health. There's a late onset of Alzheimer's. Your memory health is improved. So it's all for the better. Alom Vilom is a fantastic exercise and it's very easy. All you do is breathe from alternate nostrils, right? Like you can hold, this is your thumb and this is your other finger. Put your thumb here, the other finger here. This is how to control your nostrils, and the other two right here. Okay, so when you exhale, inhale, start with the left nostril first. Inhale, shut this, exhale. Inhale, shut nostril, open nostril left. Exhale. Inhale. Exhale. Basically, you exhale and inhale from the same nostril and then change nostrils. Right? It ends up being like that. Actually inhaling and then exhaling. Then inhaling again. And then exhaling. So if you say exhalation is first, you exhale and inhale from the same nostril, alternate nostrils. Now this is a fantastic exercise, but if you do it properly where you are inhaling 1 unit at a time and exhaling 2 units at a time, you automatically create some sort of vasodilation, which is good enough if you immediately start doing hyperventilation after that. And there are many complex other ones which other exercises are there which we don't want. We're not going to that now, but there are complex ones. We can have a webinar which I can explain, which could improve. In my weekly webinars, you must check it out. I may bring this up. Then we come, why do we need this vasodilation, right? Why do we need vasodilation and this process? It's a natural process for a start of the vegetable and animal kingdom, as I told you. And it happens whenever nature requires it. Whatever is required by the process, the nature will make sure it happens. But we are deliberately creating this outcome by triggering it with our respiratory system. We are doing it ourselves. Because now we figured it out, if we do it, it is going to be a benefit to us. Why not take it if we can just use our little mind and a little action in the right form, and you get the outcome you want? Longevity. Okay. Another reason why I need to do this, to increase the blood vessels size, arteries, so the fresh clean blood goes further to the extremities and organs. And because it's got less resistance, it can go further. If it irrigates all the body parts, organs regularly, what happens is you have less degradation of cell and automatically longevity. So removal of toxins is your actual benefit. Now, I'm going to give you an example. A baby is massaged with oil and goes to sleep. Why is it so happy? Because suddenly all the toxins, whatever little body the toxin they had, they've been removed. They have no toxins left. The body is at rest, they're at peace. They go to sleep. It's very relaxing. Same way, you go to the washroom. One day you don't go, 2 days you don't go, you feel unhappy, right? You have a problem. But this is your natural expulsion of all those things, all your waste material. But sometimes when you have lactic acid, you have toxins of various kinds which are in your body parts, which are absorbed there and stay there and take a long time to come out. But when we do all these exercises, these two exercises, toxins removal, the vasodilation, this is exactly what we're doing. We're removing toxins from the tissues. From the cell level, we're removing toxins, and it may be in a small form, in a very, very minuscule form, but all this adds up. Because you do every day a little bit, it takes about 1/4 of a teaspoon of toxin every day. By the end of the year, it's nearly taken how much? Maybe the whole body full of toxins. So a little bit every day is excellent. This is what we're trying to achieve. Longevity. Now let's come to the hyperventilation part. Hyperventilation is nothing else but, in the first we said breathe 1, exhale 3. Hyperventilation is 1 to 1. Suppose I inhale 1, exhale 1, inhale 1. There's no chance of any ventilation. There's no chance of any CO to be left behind in my system. And if I do this, that was Kapalbhati. Now this was breathing with my diaphragm, diaphragmatic breathing. Now this causes expulsion of all the air on a regular basis, using your diaphragm as an which expels the air, and breathing in is automatically by the normal expiration. When you relax your muscles, your air goes in automatically. You're not breathing in. So this is the only time you're not using your lungs to breathe. You are giving your lungs a little rest. Excellent. excellent idea, because whatever time you spend not using your lungs adds to your lifespan. Yes, whatever time you don't spend using your lungs to breathe, it's added to your lifespan. But how do you breathe during that time? Use your diaphragm. You're not breathing, you're exhaling air from your lungs, and when your body comes regularly into the normal tone, your lungs expand, and normal aspiration of air comes inside. So this is the only time you give your involuntary muscle, lungs, a little rest. Very, very essential. And of course, you have the simple deep breathing, bellows, like when you take a deep breath. You can choose any exercise you wish, but my personal favorite is Kapalbhati. There are many other advantages, we'll come to that later. But in the meantime, this is done just after your hypercapnia exercise. It's only useful after vasodilation. It's a rapid maximum. Do it in a combo. Let's say they're twins, but one is useless without the others. If you do both together, you get super, absolutely clean inside and super long age for you. Well, the yogis did it. Why not you? Now, we come to the benefits. The best way would be to do all this is to sit in an easy pose. Put some music, headphones and some music. In fact, my favorite is this 5 minute, 5 minute, 5 minute, and all these timing. I don't want to open my eyes once I close my eyes, because I do meditation at the same time. So I close my eyes, I got my recordings on. In the recording itself, I've told myself that this gong will ring at 5 minutes, and this is the end of my vasodilation. Tuck. Start hyperventilating. The next 5 minutes I start hyperventilating. When that finishes, start. So I don't even want to remember the time. I don't want to open my eyes. So that is the best way of doing it, is to make your tape exactly at the right moment. You can do it with GarageBand, or if you want, you can do it on YouTube also. There is a method of doing it, making a video. You can save it as an MP3 and then use it. And this way you don't have to open your eyes. You are gone. When you're doing this, you should close your eyes. You start the meditation and you start your vasodilation, hyperventilating. All three together. You're saving time. The main thing is your mind is at calm. Then you are getting the vasodilation and you're going hyperventilation. You do it minimum of 3 times, 3 routines. That means you're talking about 10 into 3 is 30 minutes. Or if you have the time, 10 into 6, 60 minutes. You won't have to do any other exercise if you just do these 2 exercises. You may sweat. Ideally, if you do it properly, if you do it till 6, you may sweat. You will have a sheen of sweat. And technically, to reach 6 times takes a lot of effort, because even if you reach 2 times, you're going to start having, if you haven't done this before, you're going to have your stomach which is going to be paining. I haven't done this before. Why is my stomach paining? And realize you have been stretching your stomach. So guys, the main putting in the whole thing is that if you practice this, so please, there is a download file with a recording. I've made a recording for you. Download that, which tells you 5 minutes do this, 5 minutes do that, then meditation. And moreover, make your own. That'll be the best. And happy hyperventilating, happy vasodilation, and happy meditation. I want you to get to the habit of doing this routine as a reflex action, as part of you. That is the most important building block of my entire Longevity Unleashed program. This is the cornerstone. Of course, you have the food also, but this is one of the most important things, right? So to regenerate your cells. So thank you very much for watching, and do practice. Do practice. Practice makes perfect. And secondly, good luck, be happy and prosper. Thank you.